Well, Katie, that's right. Experts say the focus of the opioid epidemic is really in areas like Rochester. The most recent data from the federal government says small metro areas had the highest rate of opioid misuse. That data is from 2019, and indications are use of opioids and other drugs has increased significantly during the pandemic. Officials say it's hard to fully grasp the extent of how many people are misusing or overdosing from opioids, but it's important to know there's something each of us can do to help save lives.
Learning how to give naloxone is a life-saving measure.
Dr. Casey Clements, an emergency physician with Mayo Clinic, says naloxone or narcan has been used in hospitals and ambulances since the 70s. It can treat overdose in an emergency situation and is one of medicine's greatest tools in preventing deaths from opioids. But experts say in order to be effective, naloxone has to be used quickly.
You only have about 6 minutes when somebody stopped breathing to give them a medication to prevent organ damage, including your brain. And so having naloxone on hand in the home for people who are on higher doses of opioids, or for family and friends of people who have opioid use disorder, is really important.
Dr. Clements says Mayo Clinic's ambulance service administered 137 doses of naloxone in our community last year and 855 doses across the Midwest. He adds a widespread coalition of experts and community members are now working diligently to expand access and teach people how to use it.
Mayo Clinic, as well as multiple community organizations, as well as the Board of Pharmacy in Minnesota, are doing everything that they can to make naloxone easily available to have on hand.
And just this evening, Rochester's CIDI, along with other community partners, held a Narcan education and distribution event. Dr. Clements tells me the RPD and Olmsted County Sheriff's Office already carry naloxone, helping save more lives. Katie?
Thanks, Anthony. Dr. Clements says data sharing and trying to figure out exactly where misuse is hitting hardest will likely be the next important step in battling the opioid epidemic.